All right, what's up, YouTube? I'm back with another video. I'm going to do extubation parameters, and then I'm going to do a presentation on this and extubation process and how to set up a vent in different vent modes. All right, I'll just do my written down section. Hope y'all enjoy. All right, adult critical values. PCO2 greater than 45 and less than 35 is critical. Normal values for CO2 is 35 to 45. Vital capacity less than 10 mil per kg is critical. Greater than 10 mil per kg is normal. Spontaneous tidal volume less than 5 mil per kg is critical. Normal is 6 to 8 mil per kg. Severe is 4 to 8 mil per kg. So normal is 6 to 8 mil per kg. Spontaneous respiratory rate, critical is less than 8 and greater than 25. Normal respiratory rate is 10 to 20. Minute of ventilation, critical is less than 10 liters per minute. My bad. Minute ventilation, critical is greater than 10 liters per minute. Normal is about 5 to 6 or 5 to 10 for minute ventilation. NIF or MIP, critical is more negative than negative 20, and normal is negative 100. Static compliance, critical is less than 25. Normal static compliance is 60 to 100. VT, dead space, critical is greater than 60%. Normal dead space is 20 to 40%. RSBI, critical is greater than 100. Normal RSBI is less than 100. Vital signs, increase heart rate, increase blood pressure. PaO2 of greater than 60 millimeters per mercury, or SaO2 of greater than 90% on an FiO2 of less than 40% to not be critical. QSQT shunt, critical is greater than 20%. Normal QSQT shunt is less than 5%. Alveolar arterial gradient, critical is greater than 300 millimeters of mercury. Normal alveolar arterial gradient is 25 to 65 millimeters of mercury. PF ratio, PaO2 divided by FiO2, critical is less than 200 millimeters of mercury. Measures ARDS. Normal PF ratio is greater than 380. Adult extubation parameters. CO2 35 to 45. Vital capacity greater than 10 millimeters per kilogram. Tidal volume 5 to 8 milliliters per kilogram. Respiratory rate 8 to 25 breaths per minute. Minute ventilation 5 to 10 liters per minute. NIF or MIP, negative 20 to negative 100. Static compliance 25 to 100. Static compliance 25 to 100. Dead space 20 to 66. Dead space 20 to 66. RSBI less than 100. Normal vitals PaO2 greater than 60. SaO2 greater than 90% on an FiO2 of less than 40% equals normal. QSQT shunt less than 20%. QSQT shunt less than 20%. AaO2. Alveolar arterial, less than 300 millimeters of mercury. Alveolar arterial should be equal to less than 300 millimeters of mercury for extubation. PF ratio should be greater than 200 millimeters of mercury. PF ratio, PaO2, FiO2 should be greater than 200 millimeters of mercury. And ABG should be 7.35 to 7.45 for pH. CO2 35 to 45. CO2 35 to 45. Bicarb 22 to 26. Bicarb 22 to 26. Oxygen 80 to 100. Oxygen 80 to 100. With extubation, you want to do pre and post suction. The pre-suction, you want to suction above the cuff and below the cuff. If you hear stuff in the lungs, some junk, you always want to suction afterwards just to make sure if they need it. All right, then you want to do a leak test before you extubate to make sure that the airway hasn't closed, and if it has, then you give them racemic epinephrine. Post O2 for extubation, you want like a cannula or a BiPAP or a oxy mask or something. Go with BiPAP for if they're not ventilating well, if they have bad blood gases. Their blood gases aren't perfect, but they're still passing their spontaneous trials. Go with BiPAP. All right, neonate extubation criteria: PIP 15 to 18, PIP 15 to 18, PEEP 3 to 4, PEEP 3 to 4. Rate less than 10 breaths per minute, rate less than 10 breaths per minute. FiO2 equal to or less than 40%. FiO2 equal to or less than 40%. Feeding should be withheld several hours before extubation. Tracheal bronchial hygiene prior to extubation. So you want to suction down below and above right before you extubate. You want to definitely want to get the suctioning before extubation. If no air leak on test, use racemic epinephrine. All right, and then you want to do the air leak if they have a cuff to make sure that their trachea hasn't swollen. With ABGs, I think with suctioning, you want to go, you don't want to poke the carina, so you only want to go a certain amount down. You want to go not all the way down. You want it to be less than 10 seconds. All right, ABGs. Term baby ABG should be pH 7.3 to 7.4. Term pH 7.3 to 7.4. Term CO2 30 to 40. Term CO2 30 to 40. Term bicarb 20 to 22. Term bicarb 20 to 22. Term O2 80 to 100. Term oxygen O2 80 to 100. Preemie 28 to 40 weeks. pH greater than equal to or greater than 7.2 or 7.25. Preemie 28 to 40 weeks, pH should be equal to or greater than 7.2 or 7.25. Preemie 28 to 40 weeks, CO2 should be 45 to 55 or 60. Preemie 28 to 40 weeks should have a CO2 of 45 to 55 or 60. Preemie 28 to 40 weeks should have a bicarb of 18 to 20. Preemie of 28 to 40 weeks should have a bicarb of 18 to 20. Preemie 28 to 40 weeks should have a PaO2 of 50 to 70. Preemie 28 to 40 weeks should have a PaO2 of 50 to 70. Preemie less than 28 weeks should have a pH of equal to or greater than 7.2. Preemie of less than 28 weeks should have a CO2 of 40 to 55. Preemie less than 28 weeks should have a CO2 of 40 to 55. Preemie of less than 28 weeks should have a bicarb of 15 to 18. Preemie of less than 28 weeks should have a bicarb of 15 to 18. Preemie of less than 28 weeks should have a PaO2 of 45 to 65. Preemie of less than 28 weeks should have a PaO2 of 45 to 65. We got the RAM cannula, CPAP, heated high flow, nasal cannula, non-rebreather, and the face masks for post-extubation modalities. All right, adult initial vent settings. Tidal volume 6 to 8 mils per kilogram. Respiratory rate 10 to 20. FiO2 40 to 60, or what they were on before. PEEP 3 to 6, or what they were on before. I time 0.8 to 1. IE should be 1 to 2, or 1 to 4. Slope rise should be 0.2. Pressure inspiratory should be 5 to 15. Never exceed 35. Plateau should be less than 30. I think I wrote that one wrong. It should be plateau less than 30. All right, neonate vent setup. Tidal volume for preemies is 4 to 6 milliliters per kilogram. Tidal volume for preemie is 4 to 6 milliliters per kilogram. Term tidal volume is 4 to 8 milliliters per kilogram. Term tidal volume is 4 to 8 milliliters per kilogram. So preemie is 4 to 6, preemie 4 to 6, term 4 to 8, term 4 to 8. Child, adult, pediatric. Tidal volume should be 6 to 8 milliliters per kilogram. Child tidal volume, child adult tidal volume 6 to 8 milliliters per kilogram. PIP 15 to 25 or 20 to 30. PIP 15 to 25 or 20 to 30. PC CMV pressure inspiratory should be 1/2 of gestational age. Pressure inspiratory should be 1/2 of gestational age. Rate should be 30 to 60. Rate should be 30 to 60. Rate should be 30 to 60. Flow should be 4 to 6 for neonate. Flow should be 4 to 6 for neonate. Flow should be 25 to 30 liters per minute for a child. Flow should be 25 to 30 liters per minute for a child. TI, I time for preemie should be 0.25 to 0.5. I time for preemie should be 0.25 to 0.5. Term I time should be 0.4 to 0.6. Term I time should be 0.4 to 0.6. Pediatrics I time should be 0.8 to 1.0. Pediatrics I time should be 0.8 to 1.0. General rule is 0.4. You know, rules of 4. Neonate IE ratio should be 1:1 to 1:3. FiO2 should be low, 21%. You want to go as low as you can, 40 to 50. I don't know if that's right, but at least 21% or 10% greater than previous, because you don't want the baby to get oxygen toxicity or retinopathy or prematurity with too high of oxygen. FiO2, 20% oxygen or 10% greater than previous. PEEP should be 3 to 5 cm H2O or equal to previous. PEEP should be 3 to 5 cm H2O or equal to previous. Mean airway pressure should be less than 12. Mean airway pressure should be less than 12. All right, so ram cannula, I'm gonna go with that just because that's probably what we would extubate the neonate to. Ram cannula, baby BiPAP indicated post intubation, or if they're less than 6 months old. Contraindicated, ram cannula is contraindicated with severe lung disease, diaphragmatic hernia, and thoracic surgery. Settings for ram cannula: flow rate should be 1/2 of gestational age. PIP 20 or 3 to 4 higher than invasive. PIP 20 or 3 or 4 higher than invasive. Ram cannula PEEP should be 5 to 6 cm H2O. Ram cannula PEEP should be 5 to 6 cm H2O. I'd go 3 to 5, like the initial vent. Rate should be 20 to 30 for ram cannula. Rate should be 20 to 30. Eye time should be, for ram cannula, should be 0.3 to 0.5. Rules of 4, 0.4. Or 0.5 greater than invasive. Eye time for ram cannula should be 0.3 to 0.5 or 0.5 greater than invasive. You also go rules of 4 for eye time, 0.4. How to wean ram cannula: wean pressure, then rate. And that's the end of my video. Hope you all enjoyed. Peace out.